Virtual? Okay, great. Thank you. Well, thank you for coming today to the Mayo Credit Union presentation on optimizing annual enrollment, where the annual enrollment period starts today, October 15th, and there's changes coming for next year. So we're going to go over all of that. If you didn't get one of these handouts, there's a few left on the table back here, and there's refreshments in the back. My name is Dave Brown, and I am with TrueLink Medicare Advisors. We are owned by the Minnesota Credit Union Network, which is the trade association for credit unions like the Mayo Employees Federal Credit Union. And we represent credit unions all across the state. We're here to help really anybody who needs help with their Medicare. I've been doing Medicare for over 17 years now, so we're happy to be here to help you. During the presentation, if you have any questions, if you just raise your hand and ask, I try to answer questions as we go along. If you're online watching virtually, if you want to enter that into the chat, is it chat or question and answer that's being used? Chat. If you enter that into the chat, we'll try to answer those as we go along also. So with that, we'll get started. You got this handout. At the end, there's this form. It might be white or it might be this color. But if you need help at the end, if you'll fill this out and leave your email address on here, I'll try to connect with you email. I can tell you right now things are getting very busy, and some of you may need to use VIA benefits. So if you're familiar with VIA benefits, that's a service that the Mayo Clinic uses for employees whose employment started prior to January 1 of 2002. If your employment started prior to that, your HR department's going to let you know, if they haven't already, that you're most likely eligible to get help through a company called VIA Benefits. If you're eligible for that, then you get a health reimbursement money every year to help you pay for things, which is why if you are eligible for that, you would want to go through VIA Benefits. You don't want to use me. If you sign up for a plan with me, you'll lose that health reimbursement money from VIA Benefits. So just a heads up again, if your employment started prior to January 1, 2002 with the Mayo Clinic, they're going to let you know that most likely you're going to need to use VIA Benefits. But I am here to answer questions today if you need any of that. So we will get started. So in Minnesota, we are licensed and contracted with all of the Medicare Advantage plans that are available. We are contracted with many of the Medigap supplement plans and many of the standalone prescription drug plans. And we are licensed in many other states, including Arizona and Florida, if you're watching virtually from the Mayo facilities in those states. So optimizing annual enrollment. We'll talk about why would you want to use TrueLink Medicare Advisors. We're going to talk about annual notice of change. If you're on Medicare now, you received something called the annual notice of change in the mail very recently. The changes that are coming to Medicare next year. We'll talk about the different enrollment periods, and we'll talk about income. If you're lower income, how you can get help for that, and if you're higher income, how you're going to be assessed a surcharge once you go on to Medicare. We'll talk about cost of living adjustments and then your next steps. So our services, there's never a cost for our services. If we help you with your Medicare and we sign you up for a plan, typically we'd get paid a commission by the insurance carriers, but you will never pay us anything for our help. We're here to help provide education and understanding the whys and hows of Medicare, and we're available throughout the year for questions and assistance. And then during open enrollment, which just started today, we also review our clients' coverages every year. We send out an email and a letter in August asking folks to update their prescription medications, and if you respond to that, then we'll review that, and if your plan is changing to where you'd be better off with something else, we try to schedule a time to meet with you to do that. So to Original Medicare, there's two parts to Original Medicare. There's Part A, which covers hospitalization, skilled nursing, home health care, and hospice. There's not a monthly premium for Medicare Part A. Medicare Part B covers doctors and specialists, ambulance, medical equipment, those types of things, outpatient surgeries. There is a monthly premium for Medicare Part B. This year, for most people, it's $185 a month, and next year it's projected to go up to $206.50 a month. That number's not final. They'll announce that by the end of November, but it's most likely going to be in this range for your Medicare Part B for next year. If you're collecting your Social Security benefits, your Medicare Part B premium comes right out of your Social Security check. If you're not collecting Social Security benefits yet, you'll be mailed a bill to pay that either quarterly or monthly. Any questions on that? Okay. There are things that original Medicare does not cover. If all you have is original Medicare Part A and B, you won't have dental coverage, you won't have vision or hearing coverage, you won't have worldwide coverage or outpatient prescription drug coverage. So we'll talk about plans that will cover those sorts of things. So private health insurance options. There are different types of plans in the Medicare space. There are Medigap or supplement plans. There are Medicare Advantage plans, also known as Part C. And then there are standalone prescription drug plans known as Part D. We will go over these. In Minnesota, we call Medigap plans a little different than what most of the country does. In most states, they're called Plan F or Plan G or Plan N. In Minnesota, we don't call them that. We call them basic plans, extended basic. Some insurance carriers have a copay plan and some have a high deductible plan. With Medicare, Medigap plans, it's just your medical coverage that you're getting when you sign up for one of these. You do not get prescription drug coverage and you do not get dental and vision coverage. If you want those coverages, you have to buy additional policies for those. With Medigap plans, for most plans, there's not a network. Any provider that accepts Medicare will accept your Medigap plan, either in Minnesota or across the country. So you don't have to worry about the networks. If you travel, leave the state of the country, it travels with you. And if you move to another state, you can keep your Medigap plan. You don't have to give it up like you would a Medicare Advantage plan. If you do not sign up for a Medigap plan when you're first eligible, down the road, first eligible for Medicare Part B, I should say, if you wait longer than 6 months after your Medicare Part B starts, you'll be asked health questions if you want to sign up for a Medigap plan. That's changing a little bit in Minnesota. The legislature created an annual enrollment period for Medigap plans in Minnesota, and that bill has changed a little bit since it first came out a few years ago. So right now, it's going to go into effect next year in 2026 in August, and there will be an annual enrollment period for Medigap plans in Minnesota from October 15th through December 7th. But if you wanted to switch from an Advantage plan to a Medigap plan, you can up until age 70, starting next fall. And if you choose to do that, they're going to add on like a premium to what everybody else pays on yours. So that's something to really think through when you decide whether you want an Advantage plan or a Medigap plan. Advantage plans work really great in Minnesota. Some states they're not so great, but they work well for the most part, very well in Minnesota. Yes?
Are they going to tack on a premium if you do it prior to August of next year? So if people losing their Advantage plans this year can jump on a supplemental?
I'm glad, yeah. So for the folks who have UCare or a Blue Cross plan that's going away next year, you have the right to go into a Medigap, a basic Medigap plan without health questions because you're losing your plan. Minnesota limits how many of the options you have for a Medigap plan, but if you're losing your plan, like UCare, everybody's losing their UCare, or in Olmsted County, Blue Cross is moving down to just one Medicare Advantage plan, but if you're losing the plan you have this year, you do have a guaranteed issue right for a Medigap basic plan for next year. And if that's you and you need help with it, well, if you use via benefits, you'd need to go through them. But if you don't and you need help with that, we can try to help you with that. So did that answer your question? Okay, great. So with Medicare Advantage plans, for one monthly premium, you're going to get your medical, prescription drug coverage, dental, vision, and hearing coverage all together in one plan. The Advantage plans in Minnesota and across the country, they use networks. There's two different types of Medicare Advantage plans. There are HMO plans and there are PPO plans. If you go with an Advantage plan that's an HMO plan, you're going to be limited on how you can use it and where you can use it, and you might need referrals to see a specialist. If you go with a PPO plan, you're going to have a national network of providers you're going to be able to use with a Medicare Advantage PPO plan if you're traveling across the country, and you don't need referrals to see a specialist with a Medicare Advantage PPO plan. If you were to move, let's say if you live in Olmsted County and either you could move up to the metro, or if you move to another state, you would lose your Medicare Advantage plan and you would need to find a plan that's available wherever it is you move to. But again, anytime you lose your plan against your will, if at that point you want to move into a Medigap plan, you do have the right to do that without being asked health questions. Medicare Advantage plans will never ask you health questions, and the benefits and the premiums can change from year to year. With Medigap plans, the benefits never change, but the premiums change from year to year. Yes?
You said if you move against your will, what if you move just because you want to move?
No, so let's say if you move to Wisconsin or Florida or Arizona, if you have a Medicare Advantage plan, you're going to lose it. So because you're losing it, you didn't say, I don't want my plan anymore, you're going to lose it because you're moving. Then you have the right to either go with a Medigap plan in that state you're moving to, or a Medicare Advantage plan.
Okay.
Yeah. Any other questions on that? Yes?
We've got a question online. Are the Plan B and Medigap premiums based on age, or are they community-based in Southeast Minnesota?
So Minnesota has community-based premiums for the Medigap plans. Some states are age-rated. In Minnesota, they're community-rated, which means everybody pays the same price for their Medigap plan in Minnesota. The caveat to that is if you're a tobacco user or a smoker, your rate's going to be higher than if you're not a tobacco user or a smoker. But they're community-rated in Minnesota. Good question. And then if you do go with a Medigap plan, if you want prescription drug coverage, you would need to sign up for a standalone prescription drug plan or a Medicare Part D plan. And there's a variety of carriers and options out there. If we meet with you, we're going to ask you for a list of your prescription medications. We'll look them up in the Medicare Plan Finder, and that's going to tell us if they cover all of your medications, if you're going to have a deductible that you have to pay first on some, and what your costs at the pharmacy would be. So each company has a formulary, which is a list of medications that they cover. Not everybody covers the same medications. That's why we look them up for you. But if they are in formulary, then there's going to be different tiers of coverage. So tiers 1 and 2 are generally your generic medications. Tiers 3 and 4 typically are brand name medications. And tier 5 would be if you had any specialty medications. The higher the tier, the higher your copay or coinsurance would be. If you don't sign up for a prescription drug coverage when you first go on to Medicare Part A and B, this is once you leave an employer plan, you wait. I've been doing this 17 years. There are people who say, I don't take prescriptions and I'm never going to. That's fine. Some of them never do. But some end up taking them, and if you do sign up later for a prescription drug coverage and you never had it when you first started, there's a penalty you're going to pay. It's based on a national average and the number of years you went without. But if that's you and you want to pay that penalty, then it's going to get added onto your monthly premium every month for the rest of your life. So there are options, affordable options for people who are in that situation who maybe you don't want to pay a lot for a prescription drug plan, but if you sign up for one of those cheaper options, then you avoid that penalty. Yes?
Got 2 questions online. The first one is, what is cost on this slide?
Oh, they talked about cost plans. So in some states, there's what's called Medicare cost plans. In Minnesota, we used to have them across the entire state. That changed in 2018. Now in Minnesota, there are 21 counties that have what's called Medicare cost plans. I think Goodhue County is the closest. So if your county has Medicare cost plans, carriers like Blue Cross and Medica offer those plans. They cannot offer you a cost plan and an Advantage plan. They have to offer you the cost plans. But it's just a technicality. They're kind of a hybrid between Advantage and Medigap plans. But those are available to people who live in the 21 counties in Minnesota who still have cost plans.
Great, thank you. And the second question is, does Medigap travel with you if you move?
Medigap will travel with you. So if you have a Medigap plan in Minnesota or whatever state, it will travel with you. You don't lose it if you move to another state. The downside to that is in Minnesota, we have some of the highest priced Medigap plans in the country. You might want to lose it, because if you did lose it and wanted a Medigap plan in the state you're moving to, you're probably going to get one for less money than what you're paying in Minnesota. But because you don't lose your Medigap plan if you move to another state in Minnesota, that doesn't qualify you to get a Medigap plan in that state without underwriting. You would be asked health questions if you wanted to switch to one. And as long as you can answer no to all the health questions, you can get it. But for most people, that's not a reality. Yeah.
And you have to answer underwriting even if you do a side shift from a Medigap to another Medigap.
Some companies will allow you to move up or down within their company for a Medigap without that, but some don't. Yeah. I can tell you, if you're going to be living in Olmsted County the rest of your life and using the Mayo system, well, the biggest challenge for Medicare Advantage in Olmsted County would be if you're going to live in, I was just at a senior living facility earlier today, and they only accept Medigap plans for their services within that facility. But there are 15 other facilities in Olmsted County that take Medicare Advantage plans for like rehabilitation or something like that. But that could be an issue. But if you have flexibility on where you're going to go, it's not going to be as a big of an issue. Yes.
If you move out of state and you're on an Advantage plan, can you then go to a Medigap plan?
Yeah. So if you move out of state and you have an Advantage plan, you'll lose your Advantage plan. Because you're losing your plan, if you want to go to a Medigap plan, the state you move to, yes, you can do that without the underwriting or the health questions. Okay? And then something new that started this year, the government has capped the cost of people's prescriptions this year at $2,000. So if you spend $2,000 towards the cost of your prescriptions before the end of the year, then you no longer pay anything for your prescriptions. The insurance carriers have to pay 100% of the cost of your prescriptions. Yes?
Is that for any prescription or just prescriptions that are covered under the drug?
It's only for prescriptions that are covered within the formulary of the insurance carrier you use. Good question. And for a lot of people, that's not a true $2,000 out of pocket. There's a national formula that's used. It includes a deductible if you have to pay a deductible. But any prescriptions that are within the formulary of your insurance carrier this year, if you reached that $2,000 limit, then you no longer pay anything for your prescriptions the rest of the year. Next year, it goes up to $2,100. Yes?
Can companies change their formularies or tiers?
They change every year.
But I mean, after you sign up, can they change?
They have mid-year, some do, yes. I don't know why the government allows that, but some do. Yeah. I'm getting questions from people who've had experience, I'm guessing. So, yeah, so once it hits that cap next year of $2,100, if you're in that boat, you no longer pay for your prescriptions. The government also requires every prescription drug plan for Medicare starting this year to offer you a prescription payment program if you want to enroll in that. So I've had some clients this year who reached that $2,000 cap by January or February because of the expensive prescriptions they're on. Once you're retired, that could be difficult for some people to come up with that kind of money. If you're in that situation or somebody you know is, you can sign up for the Medicare prescription payment program through the insurance carrier. They all have to send you information about it, whoever you go with. There's no cost for the program, but if you sign up for that, then instead of getting hit with that cost in the first month or two, the insurance carrier will spread that cost out over 12 months. And when you go to the pharmacy, you won't pay anything for your medications. Your insurance carrier will bill you each month for the prescriptions. So this is just another way the government's come up with to try to help people who have expensive medication costs. Yes?
Is the amount that is being charged or the amount that you're co-paying?
Well, it's the amount that you're paying, but it's based on a national formula. So one of the reasons UCare got in trouble the past 2 years, they had plans where people who were on expensive medications, there was no deductible, and you only had a $47 a month copay. They're losing their shorts over that. But with them, a lot of them hit the cap, even though they were only paying $47 a month. It was based on the retail price of their prescription. It's a very complicated formula that the government's using. So for them, they didn't come close to actually paying out $2,000, but they hit that cap mid-year and they no longer had to pay, a company like UCare had to pay the full cost. And they were the only insurance carrier that did that, a $47 copay, and I think they're regretting it at this point.
So, in this case, the amount that you pay, the copay, has to reach that $2,000 or $2,100. The actual retail cost of the drug.
It's a formula of the retail cost and what you pay. I can't say that you're actually going to pay the $2,000. For a lot of people, they're not. But if we run your prescriptions through the Medicare Plan Finder, it's going to tell us what you're going to pay each month and show us if you're going to hit that. Or you can do it too. It's medicare.gov. If you enter your prescriptions in there, it's going to tell you what your costs are month by month, and then if you're going to hit that cap and what month that you would hit it.
Thank you.
Yes. Yes.
I've got a question online. Do Mayo providers accept Medicare Advantage?
Yes, they're reducing that next year. So in Minnesota, the Mayo Clinic will accept Blue Cross Blue Shield of Minnesota and Medica as in-network providers. They will not be accepting United Healthcare next year, and they will not be accepting Humana next year. This is in Minnesota. The clinics in Arizona and Florida do not accept Medicare Advantage plans at all. They only, I believe they take Medigap plans, but they do not take Medicare Advantage plans at the clinics down south. Okay?
So if we go to Mayo for our health care, we should have a Blue Cross plan or a Medica plan, Advantage plan.
Yes. So starting this year, they took Medica, Blue Cross, UCare, Humana, and United Healthcare. UCare is going away, and the Mayo Clinic's sending out letters to current clients that they will not take United Healthcare or Humana next year. So if you have those and want to go to the Mayo Clinic, if it's a Medicare Advantage plan, I'm not talking Medigap plans, but if it's a Medicare Advantage plan and you want to use the Mayo system, you're going to need Blue Cross or Medica if you live in Minnesota.
Thank you.
Yes?
I got a letter just recently that said Olmsted County was doing away with the Blue Cross Blue Shield Advantage.
So Blue Cross has, this year they have 3 Medicare Advantage plans. They're reducing that down to 1 next year.
Most expensive.
The most expensive one, $248 a month. Yeah.
Do you see a trend there? Do you think Mayo will continue that?
Well, I can't predict the future. What's happening is the Inflation Reduction Act that was passed in 2022, they reduced payments to insurance carriers that goes into effect in 2026. So they're taking a hit next year, and so big changes in plans. This year, earlier this year, Congress increased those the payments to carriers up again, but that doesn't go into effect until 2027. So we're anticipating this being a 1-year situation, but we're working with the government, and I'm not going to predict anything. So. Yeah. So annual notice of change. If you're on a Medicare Advantage plan or a prescription drug plan now, you should have received an annual notice of change. If you have UCare right now, they were very late in getting their letters out, but I think people are telling me they recently got a letter from UCare letting them know that they won't have their plans next year. But anyway, when you get your annual notice of change, it's a book about ½ an inch thick, and it's going to tell you if your monthly premiums are changing, if your co-pays are changing, if any prescription medications are going to be dropped from the formulary, that sort of thing. So if you get that, it is worth looking through that information once you get it to know what changes are happening to your plan for next year. So Medicare changes for next year. Again, I talked about Across the country, United Healthcare is leaving over 100 counties, dropping their plans. In Minnesota, Health Partners is leaving 46 counties. UCare is leaving the state altogether with their Medicare Advantage plans. Blue Cross in Olmsted County is going from 3 Medicare Advantage plans down to 1. So lots of changes for next year. If you have a Medigap plan where you have to pay a deductible for your hospital stay, that's going up next year to $1,716. Not all Medigap plans, if you add on the rider, you don't necessarily have to pay that deductible. But if you don't have that, that would be your deductible on a Medigap plan for a hospital stay. Medicare Part B, we talked about this year, that premium's $185. It's projected to go up to $206.50 a month next year. Again, that number is not a final number. That'll come out in the next few weeks. And if you have a Medigap plan where you have to pay the deductible for your going to a doctor or something, this year that's $257. It's going up to $288 next year. And again, the Part D max out-of-pocket increase is going from $2,000 to $2,100. This year, the highest insurance carrier could charge for a deductible on your prescription drug plans was $590. Next year, they can charge up to $615 for a deductible on your prescription drug plan for next year. Any questions on that? Okay. The enrollment period. So the annual enrollment period or election period, that begins today, every year from October 15th through December 7th. If you have a Medicare Advantage plan or a prescription drug plan, this is the time frame in which you can review your coverage, see what changes are happening for next year, and if you want to switch, you can switch during this time frame. If you're someone who's losing your Blue Cross plan or your UCare plan, if you don't get that done by December 7th, then you have a special enrollment period, a special election period, and that will take you through the end of the year. So agents, Medicare agents in Minnesota are just being overwhelmed right now because of all these changes. There's over 150,000 people losing their UCare, and there's some agents that are just saying, we can't help you. So we're trying to help everybody we can, and because of that, we're getting overwhelmed too. But if you're in the UCare situation and something doesn't happen by December 7th, you still have until the end of the year to make a change. And then if you have a Medicare Advantage plan and you don't make a change this year, but January comes along and you find out maybe one of your prescriptions isn't going to be covered, or you wished you'd made a change, you have one more opportunity every year from January 1 through March 31st, if you have a Medicare Advantage plan, to switch to a different Medicare Advantage plan or just drop it altogether and go back to original Medicare A and B.
Can you sign up for a supplemental plan at that point?
If you do, you'll be asked health questions. Yeah, unless you're losing your plan. Yeah. And then if you're looking at Medicare based around your 65th birth date, there's a 7-month window in which you can enroll in Medicare Part A and B. It starts 3 months before the month you turn 65, the month of, and 3 months following. If you're going to continue to work, either you or your spouse, when you turn 65, if you're on an employer plan and the employer has 20 or more employees, so if it's the Mayo plan, obviously they do, and the Mayo offers creditable coverage, you do not have to sign up for Medicare Part A and B at age 65 if you're on an employer plan, either through your employment or through your spouse's. You can wait until retirement. Some people sign up for Medicare Part A because they don't pay anything for it. However, if you have an HSA that you contribute to or a health savings account that you contribute to, you do not want to sign up for Medicare Part A. Once you're signed up for Medicare Part A, you can no longer contribute to an HSA. Yes?
Got a question in the chat. Regarding Medigap premiums, does Wisconsin use community or age-based for premium rates?
Well, I believe Wisconsin uses both from what, if I'm thinking correctly. I know Wisconsin uses age-rated for many people. So in Wisconsin, you'll start out, if you're 65, your Medigap plan is about half the price of what it would be in Minnesota. But as you get older in Wisconsin, it continues to rise. Yeah, and so if you're still working or your spouse is still working and you're both on that employer plan, When you turn 65, you do not have to sign up for Medicare Part B and pay that monthly premium. You can wait until you're ready to retire. When you are coming close to retirement, about 2 to 3 months before you're going to retire, this is for people who are past the age of 65, you would want to start signing up for Medicare Part A and B. You can do that online at ssa.gov, or you can go to the local Social Security office. If I've not heard good things about the one here in Rochester, but if they're open, they're supposed to be willing to help you. Or you can contact us, and or if you use Via Benefits, they can help you too. But you'd want to start that 2 to 3 months before you're ready to retire, so that your A and B are going to be active for the month that you're no longer going to have your employer coverage. And if you delay your Medicare Part B, beyond the age of 65, when you apply for Medicare Part B, there's also a form your employer will need to fill out. And if you had a spouse on your plan, they need to fill one out for each. But this form that's pictured gets filled out by your employer, and they're verifying that you had employer coverage. When you submit this at the same time you apply for Medicare Part B, this is what prevents any penalties for not having applied at age 65. So it's important, if you're in that situation, that this form gets submitted at the same time so that you aren't penalized. Okay? So income in Medicare. If you are lower income, this chart is for Minnesota. These dollar amounts, income amounts vary a little bit state by state. But if you're in the lower income category in retirement, there's something called extra help that's available that can reduce the cost of your Medicare Part B premium and help you with your prescription drug costs. So based on the family size, the column on the left, the percentages across the top are percentages of the federal poverty guidelines. Based on your family size, if your income is below these thresholds that are listed, you are most likely going to qualify for some extra help with your Part B and your prescription drug costs. You can find out either, well, when you originally get your Medicare card, there's a form they always send everybody. Do you want to apply for extra help? If you're not going to be lower income, it's not worth the time. But at some point, if you reach that level, you can contact Social Security to apply, or you can contact your county Department of Social Services and apply, and they will let you know if you qualify for this. The other side of the coin is if you're high income, there's something called the IRMA, or the Income-Related Monthly Adjustment Amount. And every year, Social Security works with the IRS to look at your tax returns from 2 years ago. They're always going to be looking back 2 years ago. And they're going to look at your modified adjusted gross income. So the thresholds for your modified adjusted gross income for next year, if you filed your taxes as a single person and your modified adjusted gross income from 2 years ago was over $109,000 for that year, they're going to add on a high income surcharge for your Part B and your Part D premiums. If you're married and filing jointly and your modified adjusted gross from 2 years ago was over $218,000 a year, they're going to add on a high income surcharge. So that increase, the middle column you see that says increase for Part B, the $82.60, if you're in that category, that's in addition to the $206 a month you would be paying. So the higher your income, that amount in the middle column, that's how much they're going to add on to your Part B premium. So the fourth column over where it says total Part B monthly premium, you can see if you fall into one of those categories, how much you will be paying for your Part B premium every month for the rest of the year. And then every year, Social Security works with the IRS to take a look at your tax returns from the 2 years prior. And if you reach a point where your income drops below whatever the threshold is for that year, then you no longer pay the surcharge. So it's not a lifetime surcharge. It's based on your income and your tax returns from 2 years ago, whatever year it was. And then they add on a surcharge for your Part D portion of your monthly premium also. Any questions on that?
Is there forgiveness on the sale of a home or
Good question. So they're going to let you know if you're going to be assessed a surcharge. Oftentimes, and it's up to their discretion, but for people who had a sale of a home or maybe a one-time inheritance, they tell you how you can appeal their decision. I've had people who lost on the first appeal, appealed the second time, and then they were granted the appeal. But if it's just regular income, they're going to deny your appeal. But situations like that, oftentimes they do approve it, and you won't have to pay the surcharge. Yes?
When you're looking back 2 years, if you've only been on Medicare for one of those 2 years, do they still look back 2 years when you had a higher income?
Yep, they don't care. Yeah, so if you just started Medicare this year, they're going to look at your income from 2 years ago. If you fall into these thresholds, then they're going to assess that high income surcharge for the rest of the year. Yes?
And they're not looking at adjusted gross, they're looking at gross income.
They're looking at modified adjusted gross, which nobody even knows what that is, but that's their term they're using, modify. I think if you're a CPA, maybe you understand what that is, but they call it modified adjusted gross, which they're the only ones who use that term, really, but that's what they're looking at. Yes?
Got another question in the chat. Is there a form to file to inform the government when you know your income will be decreasing?
No, is there a form to file? No, they work with the IRS every year to take a look at your tax returns from 2 years ago. And even if your income drops substantially when you go into retirement, if you had high income from 2 years ago, you're most likely going to have to pay the high income surcharge for every month for the rest of the year. Yes?
So when they say if you go, your income drops, and then 2 years later, say you've been on it for 2 years, you're paying the extra. If your income drops 2 years ago and it's gone down, do they not charge you that extra then?
Yep, so if your income from 2 years ago is below whatever, so these thresholds, the 109,218, that threshold tends to go up every year. This year I think it's 100 and, if I remember, 103 and 206, somewhere in that range. These thresholds increase every year, but if you're under that threshold from 2 years ago, then you don't get assessed the surcharge. And then cost of living trends. So the projection for the cost of living for Social Security benefits, again, this isn't final yet, but they're projecting a 2.7% cost of living increase. And the joy of that is that's going to be totally offset with the big increase in Medicare Part B. We haven't seen a Medicare Part B increase this big in a while, but to jump from 185 up to 206, again, that 206 isn't final either, but they're going to announce it within the next few weeks. That, as you can see, from 2022 through 2025, that's a pretty sizable increase based on past history. When I started this 17 years ago, the Medicare Part B premium was $57 a month. So it's gone up considerably over the years. Yeah. Okay, so things you want to consider for next year is, do you know if you have any surgeries planned? You'd want to, if you have an Advantage plan, you want to know what those copays would be. What are your health needs? Do you want a plan that combines medical, prescription drug, dental, vision, hearing, all of that together, or do you want to pay the higher premiums for a Medigap plan and those sorts of things? So there's lots to consider. If you have questions, we're here to try to answer them. Again, this year is a very busy time, but we'll try to help you answer any questions that you may have. But also, if you are someone who needs to use VIA benefits, you need to go through them and not through us. If you go through us, you'll lose that. That reimbursement money, I think this year is around $1,700. If you go through us, you won't get that money. So you would want to use VIA benefits if that applies to you. So any questions with that? Yes?
Just a general question. With Medicare, Medicare premiums is so high in Minnesota. I think you said something the highest. Why is that, even though we have like U of M and Mayo, we have access to it, so why is it more?
Well, we have, I mean, many of you have been in the healthcare profession. When they hear you're from Minnesota, if you go to work for healthcare in another state, they snatch you up right away. We have a strong reputation for healthcare in Minnesota, but we also have, for Medigap plans, higher costs. I don't know why that is, to tell you the truth. For instance, if you were to go with a Medigap plan where you just pay that $288 deductible and then you have no copays, if you're a non-smoker, Next year, that's going up well over $300 a month just for your medical coverage. And then for prescription drug coverage, those plans are going to run anywhere from $5 to over $100 a month. And if you want dental and vision, you have to buy policies for all that. So that route, you're going to pay a higher cost for monthly premiums, but that doesn't mean it's the wrong option for you. It's just, it's what's important to you. Medicare Advantage plans in this area, the one Blue Cross plan next year is going to be $248, and that combines your medical, prescription drug, dental, vision, hearing, free gym membership, all of that together. Medica's is going to be $159 a month next year. They also have a zero premium one. But so there's different options. Olmsted County is a tougher county. Southern Minnesota has the highest priced Advantage plans in the state because working with the Mayo, it's just more expensive for provider reimbursement than it is with other providers in the state. And Mayo gets what they want. I mean, they should. They're the premier facility. So, yeah. Yes.
How do you feel about hospital indemnity plans attached to the Advantage plan?
I don't see the point of it. So hospital, she asked the question, what's, a lot of agents are, especially this year, trying to sell hospital indemnity plans. If you have an Advantage plan, like that Blue Cross plan, you might have a $400 copay for the hospital. Everything else is covered. With Medica, I think it's $350 copay. So if you want to pay for a plan where, you know, it's going to cover that copay, I don't see the need for them. It doesn't mean you have to agree with that, but it's a way for an agent to make more commissions. In some states, in a lot of states, Arizona, Florida, zero premium Advantage plans are very popular, and which you have high copays and high maximum out-of-pocket costs. In those instances, those indemnity plans are probably a very good idea. Minnesota has the best, strongest Advantage plans in the country. I've never sold them because I just didn't see the need for them. Okay. Yes?
What's the difference between the Medica and the Blue Cross Blue Shield? You just said the premium for the Medica is about $150.
Yeah.
Does that include this dental, vision, drug costs on top of that?
Yeah, so the Medica plan next year is $159 a month. It includes medical, prescription drug, dental, vision, hearing. The Blue Cross plan, they're going down to one plan, $248 a month. The biggest difference, well, one of the biggest differences is how the dental works. With Medica, they give you a Visa debit card loaded with whatever that allowance is, and you can go to any dentist you want that accepts Visa. With Blue Cross, you need to use a dentist that's in their network. And dental networks are shrinking, which is why Medica is kind of getting away from networks. More and more dentists are just not accepting insurance. So it's getting a little harder to find dentists that are in the Blue Cross network, but here in Rochester, there's still several who are. But if you have a dentist you like, and if they're not willing to bill your Advantage plan, then you pay the full cost. But yeah, there's just there's differences in co-pays between the Blue Cross and Medica, but 97% of providers are in network with both in Minnesota for doctors and hospitals. That's not always true of, like, if you need rehabilitation or skilled nursing or those sorts of things. But yeah. Yes?
If you don't go through an Advantage plan, you just go through the regular plan. Is there any good insurance out there, companies that provide dental, vision?
Yeah, so I myself use a company called Guardian Life Dental, and I use it for my vision too. You can't get Guardian Life through an agent that I'm aware of, but if you Google it online, they have different plan options for dental, they have different plan options for vision, and Guardian Life Vision actually uses a company called VSP, which most people are familiar with, for vision, and when I signed up for it, their rates were cheaper than if I'd have gone directly through VSP. So,
And that's
Guardian.
Guardian.
Guardian Life, and either dental or Guardian Life Vision.
How do you spell that?
Guardian. And if you Google them, they'll have their phone number on their website. But that's who I'm using.
Okay, that's vision and dental.
You can get a vision plan and you can get a dental plan through them.
I just know
There-
they say there's no good dental plan out there.
Delta Dental of Minnesota, it used to be good. Boy, you're not going to get much from them anymore. There aren't a lot of good options for dental. Even with the Guardian Life, you would want to make sure your dentist accepts it. It's just, again, more and more dentists are just getting away from accepting insurance altogether. Many of them are offering their own plans. If you pay them X amount of dollars, they'll do certain work, but yeah. Yes?
So we just go online to look at the Blue Cross Blue Shield plan to see the breakdown of what dental vision costs and
Yeah, you can.
everything you get. Is that what?
If you, for their Advantage plans, if you go to the, it's BCBS, Blue Cross Blue Shield MN, BCBS MN, they'll ask for your zip code, and one Advantage plan will come up if you're in Olmsted County. The same with Medica, it's just medica.com. And yes, they'll show you, they'll give you the information on it, yes.
Can you sign up as well? Just agents being busy, if I leave here and I know that's what I want, can I just go online and sign up?
You can, if you want to. Yeah, you won't have an agent, but yes, you can.
Okay.
Yeah, and yeah, I mean, if you need help, we're going to try to, which, speaking of that, I don't want to scare everybody off and say we can't help you. I just want to know that if you fill this out and leave your information, if you leave an email, we're going to send you an email thanking you for coming, and we're going to ask you if you need help with your Medicare. We will work to help you if we can. Oh, I forgot what I was going to say. Oh, but if you have to use VIA benefits, you don't need to fill this out because you don't want to lose out on that health reimbursement money. So, any other questions? Yes.
So to back up, Medicare supplement plans, not MAP, Blue Cross Blue Shield and Medica is what Mayo's gonna take next year.
So for Medicare Advantage plans in Minnesota, for the Mayo Clinic in Rochester, they will accept Advantage plans from Blue Cross and Medica. They're sending out notices right now that they will not, and it came out in the paper that United Healthcare will not be in network with the Mayo Clinic in Rochester next year for their Advantage plans. Their Medigap plans are, and Humana will not be.
But the supplemental plans.
All the supplemental Medigap plans, all of them are in network. They don't have networks, so any supplemental Medigap plan, you don't have to worry about if the Mayo is going to take it or not. Yes.
And then when we did the Blue Cross Blue Shield and VIA benefits, there was these add-ons.
Yes.
Can you explain those a little more?
So yeah, so with Medigap plans, let me go back to that slide. They have add-ons. Let me get there. Find it here. Oh, here it is. Okay. So there's add-ons. So you can see under Medicare Part A, there's a deductible for the first 60 days in hospital. If you take that, oftentimes it's a $4 a month add-on. If you take that, then that does away with you having to pay the $1,700 deductible if you have a hospital stay. Those add-ons, in my opinion, are well worth the money. One of them's a dollar for an add-on. But take those and you don't have to worry about some of these deductibles and costs per day and all of that. They're very economically priced, and you think, well, if it never happens to you, then you paid $40 a month more than what you needed to. If it does happen, you've saved a ton of money.
But the add-ons you get through Part A and Part B?
No, the add-on would be if you sign up for certain types of Medigap plans, like the basic or extended basic plan, you have some add-on options to cover other expenses. One, there's an option for if you need additional blood, yeah, different types of things. Yes?
Got a question online. Are Medica plans only available to retired employees?
Medicare plans are available to people who are on Medicare Part A and B. So if you're still working and have the Mayo Health plan, you wouldn't need that, but if you're on Medicare Part A and B and didn't want your Mayo plan but wanted a Medicare Advantage plan, it would be available to you. Yes?
So with Blue Cross, they have only one Advantage plan, and Medica, do they have only one?
I think Medica has 3 for next year. I think it's a 0 premium, a $47 plan, and a $159 plan. And that's going from memory, which can be faulty. There was some, yes?
You talked about Olmsted County. What about if you're not in Olmsted County?
Yeah.
Does it vary by county?
It does vary by county. Like I said, if you're in Goodhue, then you have Medicare cost plans available and not the Medicare Advantage plans. If you're up in the metro, they're priced very differently than what they are in southern Minnesota. If you're in Mower County or Freeborn or, but there's only 5 counties where Blue Cross Blue Shield is down to 1 Advantage plan. So Olmsted County, Freeborn, Wabasha, Watonwan, and there's one other county where only 1 Blue Cross Medicare Advantage plan is going to be available. Olmsted, part of that. If you're in another southern Minnesota county, you're still going to have 3 options available. But for Olmsted County, they've reduced it down to 1 plan option for Medicare Advantage, they being Blue Cross Blue Shield. The companies make that decision, yes.
Is there anything to the risk pool with Blue Cross Blue Shield versus Medica?
I don't know that there's anything. So with Medicare Advantage plans, Medicare pays the insurance carrier X number of dollars per month to take care of you, and then they've got to figure out how they can do that affordably. I don't know that there's anything to the risk pool. Medica has the strongest record in the state for not denying claims, and for when a doctor asks for a prior authorization, they approve 96% of prior authorization requests in 24 hours.
And that beats Blue Cross Blue Shield.
It does beat Blue Cross Blue Shield.
Are they a PPO or a HMO?
They're a PPO. Yeah. Yes?
Does Medica have a Medigap plan?
Medica has a Medigap plan, yes. Mm-hmm.
And then another question, if I'm gonna switch to a Medigap plan next year, if I choose one, a Medigap with a lower premium, but then another year I wanna switch to a different Medigap, can I do that with like a higher premium?
If you do it within the same company, oftentimes they'll allow you to move up without the health questions. If you switch to a different Medigap company, then you'll be asked health questions. Some companies have a pretty poor record of starting prices low and then jacking them up. In Minnesota, it's a little different because it's community rated, but they still, yeah. So, and there's tons of, Cigna, Aetna, United Healthcare, AARP. There's a lot of Medigap plan options, Mutual of Omaha. If you want a plan where when you call customer service and you're dealing with people in this country, then Medica and Blue Cross probably have the best customer service there. Yes?
I have a question online. Will Mayo Rochester accept all Blue Cross Blue Shield plans? I live in Mower County, and if I get a lower BCBS plan, I'm worried Mayo won't accept it.
Well, right now, for next year, the Mayo Clinic and health system is accepting all Blue Cross Medicare Advantage plans. So in Mower County, you're going to have 3 Blue Cross Medicare Advantage options.
What about Wabasha County?
Wabasha?
Yeah.
They're going to be down to 1 Blue Cross option for next year. Yes?
Does there come a day where Mayo doesn't accept Blue Cross Blue Shield?
Well, there may come a day when Mayo doesn't accept Medicare Advantage plans. I mean, that's been talked about for years. I don't know. That's a lot of clients they would be losing if they did. But again, I can't predict the future. There are forces within the government that want to do away with these types of plans altogether. They want to go to a one-payer system where the government's the health insurance company, like Canada and Europe have. Yeah. Yes? Oh.
Question from Steve B. Cigna just sold their Medicare business. Does this change allow me to pick a new claim provider without underwriting?
So with Cigna, they changed, you're right, and they're changing their name to HealthSpring, but because you're not losing your plan, it does not give you the option to go to Medigap plans without the underwriting. It would only be if you're losing your plan. And just because Cigna sold to something else, you're not losing your plan, so you wouldn't be, no. If you can answer no to all the health questions, then you can get it, but yeah. Yes?
And if you go to Advantage plan, can you go back to just not doing an Advantage plan next year?
You mean if you start out with an Advantage plan, or?
Or if you go
So,
Medicare Advantage plan next year.
yeah, so if you have a Medigap plan now and you want to try a Medicare Advantage plan, you have 1 year you can try a Medicare Advantage plan. At the end of that 12 months, if you decide you want to go back to the Medigap plan that you had, you can do that without any health questions being asked. You have a 12-month period, you can do that. If you wait longer than that, you're going to be asked health questions, but you'd have to go back to the same Medigap plan that you had before going on to Medicare Advantage.
Do you have to wait the 12 months to do that?
You would, yes. So this time of year, if you decided you wanted to go back to your Medigap plan, then this would be the time of year you would do that. And then it would take effect January 1. Yes?
Can you be forced, I mean, how far can they be forced to travel if you're out of network? And if Mayo decides not to take a plan,
Mm-hmm.
can be forced to travel or move?
Well, you would have to find a provider that's in network. Oftentimes when that happens, like for Olmsted County, if Mayo drops out, Medicare may require that insurance carrier to drop the plans that they're offering, because a certain percentage of providers within a county have to be within that plan's network. And if they fall below that number, then Medicare is probably going to, most likely says, you can no longer offer that plan in Olmsted County. If that were to happen, then you have the option to go with a Medigap plan without the health underwriting. That's what's going on with UCare and some of the Blue Cross plans right now. If that made any sense.
So it's not possible to be denied, to be underwritten and denied, somebody has to accept it?
Well, if you're on a Medigap plan, everybody who takes Medicare will accept your Medigap plan for the most part. I say for the most part. Well, I say for the most part because Blue Cross offers 2 plans that have Select in the title, like Senior Gold. And with those Blue Cross Select Medigap plans, they still have it's called the Aware Network, but they still have a network, even though it's a Medigap plan. It gets confusing, but yeah. Yes?
So why is UCare leaving Olmsted County?
Well, UCare is leaving the entire state because they've lost almost $500 million on some plan designs they've had over the past 2 years that have cost them a lot of money.
Do they exist within other states then?
They do. I don't know if they're going to continue to offer their Medicare Advantage plans in other states. They do have Medicare supplement plans that are still available. Yeah. Yes?
So, in other words, in a nutshell, a Medicare supplement plan, a Medigap, is a little less risky than an MAP.
A Medigap plan is a little less risky than a Medigap plan, but again, this is assuming what
Say that again.
a Medigap plan can be less risk than a Medicare Advantage, but that's assuming Congress doesn't make changes to things, and Congress makes changes to things. So I can't stand up here and say one is worse or better than the other because we deal with politicians. So, yes.
Just to clarify, if you're on a Medigap now and you want to switch to an Advantage and try it for a year, if I live in Olmsted County, I get 1 choice. If I live in Mower County, there'd be 3, even though we're going to be treated in the same place.
Yeah, so if you wanted to move from a Medigap to a Medicare Advantage, Olmsted County with Blue Cross, you have 1 option. In Mower County, you have 3 Blue Cross options. You can try it.
Treatment's going to be at the same place.
That's correct.
Okay.
Yeah. Medica is also an option too, yeah.
Well, you can call my address.
Okay, well, thank you for coming. I'll be available afterwards if you have any questions, but thank you for coming.
So one more thing really briefly. If you came in the door over here, you're good to go. If you came in through the link, we'll have to help you get through this patch. So we'll have to take some of you through in waves.
Let me grab a chair. Oh, or we can go to an office. Well, let's go to an office, yeah. Yes?
When you're using the term Medigap, is that the same as having Part A, Part B, and a supplement?
Yes, a Medigap and a supplement are the same thing. Yes.
Oh, thank you.
Yes, thank you.